I'd like to welcome you to a little talk on video-assisted surgery for essential hyperhidrosis. I'm Dr. Rick Fischel, and I am a thoracic surgeon, and this is one of my specialty procedures that we've had very wonderful results with. I'm going to give you a little presentation to sort of talk about it and describe what it is that we do. What I'm going to really do is tell you what we do, how we do it, why we do it that way, what our results are, and why that's different than what anybody else does. And I think you'll enjoy this. Hyperhidrosis, the word itself, really just means too much sweating. It doesn't say where, it doesn't say why, it doesn't say who's going to have it. But I like to discuss it. We're talking a lot of times about people who have excessive or dripping sweating from their hands. I call this a non-physiologic type of sweat. This is not the body trying to cool down. That's normal sweating. You need to do that to regulate heat. This is sweating that's related to a little nerve inside the body. It occurs in about 1% of the population, so it's much more common than people think. A lot of people think they're the only person in the world who has it, and then they meet other people when they come and see me and have other people in the waiting room. They talk about it and realize they're not alone. And it often runs in families. Okay? Essential hyperhidrosis essentially describes excessive sweating of the hands and feet. It may also include the face or the armpits. The sweating occurs without any provocation whatsoever, and it is usually worsened with any form of anxiety. One of the key factors that I find in this is that there's a definite mental connection. Thinking about the sweating, or thinking about your hand, or thinking about meeting somebody and having to give a presentation or shake their hand in public or something such as that will cause the problem to get worse. And the more you think about it to try and make it go away, the worse it gets. That's essentially a definite diagnosis of essential hyperhidrosis. Most of the people I meet say they've had it for as long as they can remember, and it's not associated with hypertension or any of the other things that would make you think of an endocrine disorder. This is a slide that demonstrates a patient with moderately severe hyperhidrosis. You see the shiny white sweat all over the hands. This person's just sitting there resting. They're not exercising. They're not doing anything. They're not even nervous. That's what this sort of thing is like. Okay? Where does hyperhidrosis come from? Well, as I said, it's not your body trying to cool down. It is related to a nerve. It's related to a nerve inside the body called the sympathetic nervous system. That's part of your fight or flight mechanism. That goes back to the caveman days when you had to run to survive. And it makes your heart beat faster, your blood vessels clamp down, and then you sweat. Okay? Because the blood vessels clamp down, people may often also notice that their hands or feet are quite cold. And I've met several patients who've had a diagnosis of a problem called Raynaud's phenomenon, or Raynaud's disease, where they were told that they have bad blood vessels or tight blood vessels to their hands and they're cold, and it's really not that. It's just an overactive sympathetic nervous system with another manifestation of that problem. Okay? Everybody has a sympathetic nervous system. In hyperhidrosis, the nerve is no different, either to the human eye or under a microscope. But the problem that occurs is something that we have not really fully defined. I tell people, if you picture this being the nerve inside your body, it's as if this nerve has its own little thermostat, and the thermostat is set wrong. It's set too high. So you sweat when you're not nervous, and if you are nervous, you sweat even more. Okay? Everybody has a sympathetic nervous system. Regular people, when they're nervous, will sweat from their hands, their feet, their armpits, their face. It's a sign of nervousness, and it's one of the reasons that people who have hyperhidrosis where they can't control it, it's one of the reasons they hate this problem so much. People think they're nervous or dishonest or something's wrong, and that's why they'd like to get rid of it. It's embarrassing. The differential diagnosis, things you must rule out, thyroid or adrenal disease, again, that's in someone who maybe comes to you in their mid-20s or 30s and says, I never used to sweat, now I have sweating. You rule out that they have anything else wrong. If they tell you they think about it and it gets worse, or that they've had it since childhood, it's probably hyperhidrosis. The other things listed here, many of the patients I've seen have been sent for psychiatric evaluation. They've been treated for anxiety. We look for any evidence of diabetes or malignancies. But the classic hyperhidrosis that I'm describing is very easily diagnosed, just from the things that I told you about. Why does this sort of thing happen? Well, most often it's for no reason whatsoever. Anxiety certainly makes it worse. Sometimes when you have to concentrate on an activity. I do a lot of people who work with computers, and when they think about doing it, their hands start sweating. Lotions can cause it, drinking alcohol, or certain foods can cause it. And some people notice when they eat certain foods, they may sweat a lot from their face, and we often call that gustatory sweating. One of the other types of problems that someone can have from this sympathetic nerve overactivity is actually not sweating at all, but facial blushing. And what I'm going to talk about helps to treat that problem as well. There are many non-surgical treatments that you can try for this, but in the thousands of patients that I've interviewed, most of the time these have not proven to be particularly effective. Drysol is the most common one given by dermatologists, but to use this you have to apply it at night, wrap the hand in cellophane, sleep with it, wash it off in the morning. Many of the patients describe that their hands become dried, cracked, they even will bleed, but they still sweat. So it doesn't really work all that well for people who have serious hyperhidrosis. The tap water ionophoresis, also known as a Dryonics device, is something you can soak your hands on, sends a little electric charge through. Same thing, sometimes it doesn't work, and even if it does, you have to use it over and over for the rest of your life. Something being touted in the literature and in the public eye right now is Botox injections. Most of the patients I know who've had anything to do with this said it was very painful, very expensive, didn't work that well, and didn't last that long. So it's not something that I routinely recommend. There are other things you can take, such as drugs like Robenol, anti-anxiety drugs. Patients have been treated with psychiatric drugs or alcohol soaks, all these different things. Most of the time, they're either partially effective or you have to do them over and over and over, and people get tired of it. What can we do with surgery? Well, there's several different approaches to doing surgery to treat hyperhidrosis. We've known for years that taking out a little piece of that nerve inside the body can treat this problem. It was probably discovered initially some guy had a tumor. They took it out and he said, "Hey, doctor, my hand no longer sweats." You know, that's very interesting. So they figured it out. But to do this operation, it used to require a big surgery, either opening up the chest, that's a thoracotomy, opening up your back, going through the neck, or doing what we do now, which is a video thoracoscopy through tiny little holes. The video-assisted procedure that we use is a, number one here, nerve and ganglia resection. We actually take the piece of nerve out. This copies an operation that's been performed for over 30 years with excellent results. There are other people who do different things also through a small hole with a video camera, and they will either burn the nerve, cut the nerve, or clip the nerve, and I'll discuss how that results in different results for this operation. Well, in the modern era, today, what we find are that patients are very aware of minimally invasive surgery. I first got involved with this when a neurosurgeon at Cedars-Sinai, Dr. Marty Cooper, came to me and said, "Rick, I've been treating patients for 25 years for hyperhidrosis, but what he does is make a 4-inch incision in the middle of your back, take all the muscles off of your spine, take out a piece of rib on both sides, and then pluck out this little tiny piece of nerve." The good news is it always worked to cure the sweaty hands. The bad news is it was 7 hours of surgery, 7 days in the hospital, and 7 months to recover from the pain. So he came to me and he said, "My patients, I still have patients who come to me with this, but they don't want to have that big operation because they've seen on radio, TV, the internet that somebody can do this through a tiny little hole." So patients want surgery with a little incision and have refused to have this larger operation. So we then developed a new approach. So through 2 little holes the size of a straw, we're able to do the same operation that has been successful for over 25 years. And I think that's a very important point in what we're doing. We're not making this up. We're not testing something on a nerve that we don't know what the results will be. So based on that 25-year experience with removing what's called the T2 and the T3 ganglia through the back that Dr. Cooper did, we noted his results, as I mentioned, 7-hour surgery, 7 days in the hospital. It always worked. And over the course of 30 years, he did